only 5 months old. When they were born in Algeria, the first thing they saw was each other's face, because they were born as conjoined twins. Life had started out difficult for them and was getting even harder with each passing day. Their chest walls, abdomens, heart membranes, and livers were fused together. They were missing chest and rib bones. Chifaa had hydrocephalus, which meant there was fluid accumulating in her brain, and her condition was deteriorating day by day. Surgery was a necessity for their survival, but the surgery itself was very risky.
Conjoined twins are a very rare anomaly. It occurs 1 in 100,000 births. Actually, 50% of them die in utero, and another 1/3 die within 24 hours of birth.
For the twins to survive, it was essential for a highly experienced medical team to perform the separation surgery. The risk was substantial. The family of the twins and the president of Algeria, Abdelmajid Tebboune, made the decision to entrust 5-month-old conjoined twin girls Safaa and Chifaa to Turkish doctors. In Istanbul, a healthcare army consisting of 100 people was formed at Acıbadem University Acıbadem Hospital for the twins. For the separation surgery, a multidisciplinary team of 100 people carefully planned and prepared various scenarios for all possible situations. The first step was testing. All possibilities would be calculated based on the test results.
According to the management of our twins, we searched internet extensively first, and we discovered there are only 101 conjoined twins like our patients, I mean thoracopagus. And we investigated extensively their results, and we saw that the death rate after the operation, after the separation operation, is around 50%. It means one of the twins die after the operation.
As you know, the separation operation for the conjoined twins is a vital decision because if they are not operated, they can survive. But after the separation, 1 or 2 of the twins may die. So there are also some ethic problems. So it's not an easy decision for us because 2 babies' life depends on you. So you have to decide very precisely and very good if you will be able to divide them.
At just 5 months old, Safaa and Chifaa's lives depended on a healthcare army of 100 people, and not a single one of them could afford to make a mistake. Every step had to be flawless, because even a single mistake could cost the twins' lives. That's why they would need to go through each step repeatedly.
After physical examination, we needed to have more detailed anatomic examinations. What were they? They were MRI study, CT study, and also some dynamic circulation studies.
This is a multidisciplinary decision. From our point of view, we only evaluated the liver, and after evaluating the CT scans and 3D reconstructed images of the CT scans, we decided that yes, we can divide the liver, and these 2 livers can help the babies to survive.
The twins were physically connected to each other. The healthcare army of 100 people was connected by invisible bonds. Each healthcare worker's movement had to be in harmony with the others. The twins' only chance of survival depended on this flawless coordination.
And those operations necessitate multidisciplinary approach. You have to have a lot of specialties altogether. Pediatric intensive care unit, pediatric anesthesia, anesthesiology, pediatric surgery, pediatric cardiovascular surgery, transplantation team, general surgeons, and plastic surgeons. Everybody is very important, and everybody have to be an expert in their field.
You have to trust your team because every specialty decides have to give its decision.
It was a race against time, and with each passing minute, the family's anxiety was increasing and the tension was rising. The healthcare army had to achieve perfection in a short amount of time.
The family was very nervous before the operation, and before the operation, those patients needs too much duration of preparation. It lasts weeks, even months, for tissue expanders, planning, and for everything.
After detailed tests and the decision for surgery, Safaa and Chifaa were prepared for the operation, but the doctors needed to be absolutely sure one more time. After each detail was meticulously calculated, it was time to inform the family of the final decision. Finally, the family's anxious wait would come to an end. At last, the long-awaited miraculous surgery began. Despite every step being calculated, the separation of the twins' chest walls was highly risky.
One of the most difficult parts of the conjunction was the conjoined chest wall, because there was just one sternum and it was bifid, and also the ribs were together. We needed to find a strategy to separate it. Therefore, we called plastic surgery, and they decided to put a tissue expander to gain some tissue to cover the opening after separation.
First of all, plastic surgeons started. They opened the abdomen. The position was not a formal position because they were face-to-face babies, so the position was a little bit complicated, but preoperatively we know every decision. So we know where the vessels are coming and where are they going, and we also know where the bile ducts were coming, and in our mind we had an imaginary separation plane. So in this operation we used this plane, and it was a smooth operation. We didn't injure any vessels, any bile ducts. So after the separation, and we observed that all grafts have a separate vessels and bile ducts, and we didn't injure anywhere. We didn't use any blood products. We didn't use any vessel sealing instruments.
The surgery consisted of two parts. The first part, the separation, was completed. For the first time since their birth, the twins were in separate bodies and separate places. The crucial phase was now beginning because the twins were missing chest and rib bones.
The most difficult part of this operation, actually, covering the heart and the chest after separation procedure, because there were a lack of tissue. We didn't have enough tissue to cover both babies, and those babies doesn't have a solid bone in their chest, which is very important for respiratory function. We had to create a thick, solid chest wall first after the separation procedure, and after this chest wall we had to cover with their tissues of the wound. So that was the most difficult part of the problem.
After the separation surgery, which lasted for about 9 hours with a team of 100 people, everything was finally in order. The surgery had gone well, and the twins were healthy. When they opened their eyes after the surgery, it would be the first time in their lives that they would be in their own bodies.
The operation went very smooth and without problems.
The separation point at that time, at that exact time, every team member was so happy, so excited, so emotional. They did their job in a very suitable way, and we were so happy.
The reason for our success is our teamwork. All my friends are very successful people, and they are very talented and they are very experienced surgeons. So for their part, everybody gave the correct decision, because if you make a wrong decision in any part of this operation, I can be successful, but if the heart surgeon is not successful, the babies may die. So after the operation, both babies are alive. So this is the reason for the success, I think.
I thought of my daughter, and I thought of all other children, all other patients, and I was very emotional at that point.
Safaa's condition was quite good. Chifaa, on the other hand, needed post-operative rehabilitation, but both of them had overcome the life-threatening situation.
After the operation, the babies went very well actually, and within 2 days, both separated from the respiratory support. That was very important. But one of them, who had neurological problems and hydrocephalia, needed several interventions. And he had several seizures and some problems, feeding problems, and he needed rehabilitation. But the other one had a smooth postoperative course actually.
Safaa and Chifaa woke up in separate beds for the first time in their lives, and the families of the twins were able to hold them individually for the first time. The healthcare army of 100 people who proudly passed this challenging test was filled with the happiness of their achievement.
This pathology, the thoracopagus pathology, is a challenging job to perform. Therefore, only a few pediatric surgical centers can do these operations and do this job. Our center is one of them, and therefore I am very happy and I am very excited about that.
This is the success of the hospital also, because they organized everybody very well. One mistake is enough to fail. So we didn't do any mistakes.
After the separation, when the family sees their babies separated, they have 2 children, and when we see their happiness, that's the most important thing for us.